I think like our field just attracts so many egos and just big personalities too, that makes conflict just much more likely, because there's really not a lot of timid people in our field anyway, just by nature of the job. And I see a lot of crews, bring in patients, and if they're disgruntled at the fire department, it's usually over something that's totally inconsequential to the patient, but they've made it so huge in their mind, and they're so mad. They're like, I can't believe the fire department gave aspirin to this chest pain patient. I think maybe they have a thoracic dissection. I'm like, it's probably not going to make or break, anything in this patient's outcome. And, statistically, they're probably more likely to be having an MI than a thoracic dissection. So aspirin's probably the better choice. But they've made this like one issue like such a huge sticking point, and they're so mad about it. I'm like, guys, it's really not consequential at all. Like, giving aspirin or not on this call is not worth, being super pissed off for the next 3 hours about, and being pissed off the next time you run a call with them. Like, so I feel like a lot of times it's just small issues that are really non-consequential for the patient, because it's usually not an egregious thing. It's not like the two options being debated are completely that far off. It's really just small things.
A lot of times communication, and I tell people, it's like we want to vent and all that. That's all normal. That's all healthy. However, when it gets to the point where it's just like they're just mad, it's like, okay, what's the most productive thing you could do now?
Right.
Probably have a discussion.
Right.
Kind of hash this out, figure it out, however that looks. But at least make the attempt to.
Yeah.
Otherwise, you're just like, I'm going to have a bad day every time I see that person.
Yeah. And on the ambulance, I think it's easier to stuff it down and be mad, because you guys work with at least 4 people usually. And so I think you're probably used to some interpersonal conflict and having to figure this out. Mm-hmm. Versus on the ambulance, you're like, I probably won't even see them the rest of the day. Or it's just you and your partner against the world, and you're going to be everybody that you have a conflict with, you're not really going to try to resolve it. Whether it's the ER doctor pissed you off because they didn't listen to your report, or they didn't like, the differentials that you thought were going on or something, or didn't like the medicine you gave the patient. You can, instead of asking them why, like what could I have done better, they just get mad about it the rest of the day and be like, I can't believe that, they didn't think I should have given this medication or whatever it is. I think that's easier to do on the ambulance side, when it's often seen as, the two cowboys and it's them against the world, versus having this culture of trying to solve interpersonal conflict more often. But
and definitely we're all on the same team. Like, we all want the same outcome.
We're on team patient.
Yeah.